My name is Dr. Mehul Garala. I am a physical medicine and rehab doctor, also known as a physiatrist, and I've been practicing for over 10 years. I think the biggest key is patient education. I try to build rapport with each of my patients and see how their impairment, such as pain, impacts their everyday life and try to optimize their function. And we do that through lifestyle modification, medications, physical therapy, and the potential of spinal injections. One of the huge advantages at Illinois Bone and Joint is direct care. We can efficiently see patients, quickly identify what they need, and start treatment almost immediately. I'm a non-operative conservative specialist, so anytime a patient can improve without being referred to a surgeon is a huge bonus. That's what makes it worthwhile of seeing patients improve and get back to their normal baseline. I am mainly a spine specialist, but I have almost every musculoskeletal injury you can think of through lifestyle and playing sports and weightlifting. And so I feel like I can relate a lot of times of what a patient is going through. And sometimes that's helpful in explaining their condition and overall prognosis and how to get them better.